You gotta be in the shot.
Alright. Alright, so we're Group 8. We're working on cardiovascular stents. I'm Kyle.
I'm Darren.
And I'm Robert.
So what is the problem with cardiac stents? In the United States alone, over 1 million patients each year receive coronary artery stents. Now this statistic doesn't include the number of peripheral artery stents, carotid artery stents, other major artery stents. So you can imagine that the amount of these procedures performed each year is massive. Many of these stents end up developing complications, resulting in additional surgery or side effects up to and including possible morbidity. The main cause of most of these problems is tissue growth or excessive tissue growth within the stenting region, also referred to as restenosis. And this has been shown to occur in up to 25% of patients who receive cardiovascular stent procedures.
So the way that we were hoping to try and curb this problem this problem of restenosis was we were trying to go for more of a mechanical problem. So on the outside of the stent that we were going to have, possibly adding micro ridges, which would decrease just the cell attachment to the overall outer surface of the stent, which would in turn decrease cell proliferation because are not as many cells that are being attached to the outer surface. And then on the inner surface, we were hoping to put a semi-porous layer, which was seated autologously, there we go, sourced with endothelial cells from the patient itself to try and promote a layer of endothelial cells on the inner surface to almost encase the stent within the artery, so it would be able to prevent future restenosis and then have the stent degrade over time. And just as you can see from this illustration, the outside of the stent and the inside of the stent are backwards. That's my apologies. I did this early in the morning, but essentially on the inside of the stent, we want a semi-porous structure with the seated with the endothelial cells, and then on the outer portion of the stent, we want the micro ridges to prevent cell attachment and cell proliferation.
So benefits. By using endothelial cells on the surface, we may be able to limit the ability of other tissues from getting in there. Restenosis usually occurs when the other tissues start growing in because there's no endothelial cells to tell them to stop. They can just grow on the metal as it corrodes. The ions promote tissue growth, in fact. So the goal is to have a layer of endothelial cells to get this tissue to hopefully stop growing over and closing the vein or artery. The microridges also prevent growth on the outer surface. We're hoping that things like blood cells, platelets won't stick nearly as well with these micro ridges and form more blood clots. And hopefully the implanted endothelial cells will actually integrate with ones already in the system, because a huge problem with current stents is that they're biocompatible, they're biomechanically sound, but they're not biofunctional. They don't interact positively with the tissue. Well, they promote tissue growth, but not the right kind. They promote overgrowth and close it up. And that's why most of these stents we see have to eventually be replaced. So ours should hopefully fix all the problems that those ones have, which brings me to our next point. Why use this instead of other stents? Most other stents are composed of metal, which is very corrosive, creates ions that promote tissue growth that eventually closes off the endothelial cell. We're hoping to make ours from either a metal that is meant to corrode within a certain time frame to allow that growth of endothelial cells over, so that the stent is completely biofunctional. It eventually corrodes and the artery just repairs itself. Or we've been looking into different polymers that can hold up to the medical biomechanical properties. Other stents usually prevent tissue growth with drug treatment, but the problem with that again is the drugs eventually wear off, and if you're meant to have a stent for the rest of your life, the drugs aren't going to last you 20 years. In one study, about 10% of metallic stents showed problems after they had been implanted for only 30 days. So that's the problem we're working with. Current stents do a fairly good job, but they're not designed, they're metal. They're not designed to stay in the body, and they will eventually degrade. The idea for us is turning that degradation into a positive rather than a negative. And That's our report.
Nice.
That's our pitch, yeah.
Cool. So you mentioned like thinking